Okay, let's do this one, guys. Thank you who just went to YouTube and subscribe. Really appreciate. There will be more lives being posted over there. Okay, let's do question number 41. The nurse care for a patient on cisplatin chemotherapy. Which finding are concerning? Which finding are concerning, guys? Do we need to worry about? Do we need to worry about creatinine? 1, 2, 3, 5. A, yes, definitely, definitely, Kathy. What is the normal level of creatinine? What is normal level of creatinine, guys? We done yesterday 0.6 to 1.2. Yeah, just future RN. So 2.5 is quite high. So and cisplatin is quite a nephrotoxic medication. So that's why you need to make sure we work around this finding. Okay, tinnitus. Is cisplatin ototoxic? Yeah. So this is, yes, ototoxic, definitely. This is one of the medication that work around cross-linking DNA strands, and especially it help to make like program cell death. What we call that one, apoptosis. Yeah. Okay, severe nausea and vomiting. Is it I is it expected symptom after chemotherapy for most of the medications? Yeah. Thank you, African Queen. Yes, definitely. Definitely, because and cisplatin is one of the most emetogenic medication. It is most emetogenic chemotherapy drug. So we always need to have some prophylactic antiemetics on the way. Alopecia. What is alopecia, guys? What is alopecia? Loss of hair. Yes. Yeah. And it is actually not very common in this medication. We do know like hair loss is most common side effect of many chemotherapy drug, but it is not specify or priority concern here. Okay, so that's why we need to understand whether it's concerning. No. Okay, hematuria, is it concerning? If there is a signs of blood, yeah. What it is indicating, guys? If we are seeing hematuria, what it is indicating? Kidney damage, definitely, or damage to the urinary tract. So this is slight concerning. Yeah. Well done, everyone. Okay, now we're gonna move to question number 42. I think we have done this question yesterday also. Which teaching is important for a patient starting sildenafil? Select all that apply. Do we need to contraindicate this medication with nitrates? What is sildenafil, guys? What is sildenafil? If anybody can comment, please. What kind of medication it is? AED pill. Yes. Okay, so most of the time because it work on PDE5, and so we don't need to go too deep, but it causes smooth muscles relaxation. Okay, so this one work on that enzyme. So when it cause inhibition of PDE5 that was responsible for smooth muscle relaxation, then it block the idea. Okay, it block the action. so that lead to increased blood flow to penis and proportion of erection. Yeah, so it is used for erectile dysfunction. Okay, why we need to contraindicate with nitrate? Any specific reason? Any specific? Hypotension? Yes, definitely. Regardless whether it is, yeah, it is doing vasodilation throughout the body. Okay, to increase the blood flow to penis, it is doing vasodilation, and that's why there is more hypotension. Okay, and when we have more hypotension, we don't want to give it with nitrate, because nitrate's function is also, what does nitrate do? What does nitrate do, guys? Dilates, yes. So that's why there will be double action. Okay, both medications working on the same thing, so we really don't want to vasodilate too much, because that can lead to the severe hypotension. Okay, next one, take 1 hour before sexual activity. Is A correct? Yes, because we do need enough time for drug to absorb and reach peak concentration. So definitely C is correct. Okay. Report vision or hearing loss. Report vision or hearing loss. Yeah. What kind of hearing loss patient will have? Or what kind of vision loss patient will have after having sildenafil? What kind of hearing loss they can have? Anyone? Blood. It is the word I will say is very sudden. Okay, this medication cause sudden. Wallace, actually D is correct. This medication is sudden vision loss or sudden hearing loss. Okay, out of bloom. Yeah, nothing reported, and sudden patient will stop seeing things and hearing things. So D is correct. Okay, D is correct. Yeah. Okay, safe with alpha blockers. Is this medication safe with alpha blockers? Yes. Yes, JJ. It actually also cause neuropathy, and so that's why. Can we give sildenafil with alpha blocker? No. Yes. What is the functions of alpha blockers? If we know what alpha blocker can do, what this medication is doing. Seizures too. Okay. The main thing we are, yes, Dorian, definitely. The main thing we are seeing is decrease in blood pressure. Okay, especially tamsulosin, doxazosin. These are the important one alpha blocker that we need to be careful. We really need to be careful. How many hours we can take between? Yes, it is Wallace. It is very rare because usually they don't give the medication together. That's the reason why it's very rare. If they will start prescribing these medication together, we can see it every day. How many hours? If we have to be very cautious and we are giving this medication to patient who is having tamsulosin or any other alpha blocker, how many hours they need? How many hours apart they need? Anyone? Guys, keep double tapping and sharing, please. 4 to 6. Yes, Janet. Definitely 4 hour minimum requirement. Okay. 4 hour is minimum requirement. Okay, let's do question number 23. Epoetin alpha. What kind of medication is it? And what is the common name of this class of medication? We have done maternal health in previous live session over YouTube. That video is live right now. So whenever you guys will have time, you guys can go to YouTube and watch maternal health question. The question that we are doing right now from 41 to 50 will be also posted on YouTube for your future reference, and if you guys wanna go back and watch it. Okay, so it will be available on YouTube. Okay, erythropoietin, guys. What is the erythropoietin? One of the hormone. Yes. Anyone? How does erythropoietin help? Yes, Dorian, definitely. Hormone produced by kidney, and it promote the red blood production. Yeah, by bone marrow. Okay, nice, guys. Okay, monitor blood pressure. What can happen to blood pressure? Yes, Saran, definitely red blood cells. That is erythropoiesis. Production of red blood cell is erythropoietin, and erythropoietin is the hormone produced by kidney that help with that. Okay. Okay. Do we need to monitor blood pressure and why? If anyone is there, why we need to watch? Because 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 it can cause the hypertension. The reason why it does make the red blood cell. Okay, so when we have too many red blood cell, then what is increasing the volume, the viscosity of blood cell, and we know the blood volume depend upon the osmolarity also. When it is too viscous, then definitely there is more flow of water inside. Yeah, that's why it can cause hypertension. Okay, so you need to watch for blood pressure. Check hemoglobin level. Do we need to check that one? Just Leslie, it does. It is good medication, but we need to be careful. Yeah, we need the effectiveness of drug. Okay, especially we need to check hemoglobin level, hematocrit level. Okay, we our goal is to make sure it stay within normal level, does not increase beyond that. Okay, so that's why we want to keep checking the hemoglobin level. Okay, ensure patient has adequate iron. Do we need iron for red blood cells? Do we need iron for red blood cell production? Yes, definitely. If we are giving the erythropoietin or epoetin alpha, but there is not enough base product present in the bone marrow will not be able to produce hemoglobin. Okay, and this medication will be less effective if patient doesn't have enough iron. Give IM for best absorption. Is it good to give IM? Anything? No, yes, Sunny, definitely. This medication be only yes, future RN, IV or subcutaneous. Okay, so we can't give it IM. We can't give it IM. Alrighty, stop if hemoglobin more than 11 gram. What can happen if we will not stop? Yes, likewise, we discussed before blood will be too thick, viscous, and there are chances of serious cardiovascular issues such as MI and stroke. So we need to worry about that one. Okay, yeah. So E is correct. Yes, blood clot definitely. Yeah. Okay, question number 44. A patient is prescribed theophylline. Which point should be emphasized? Select all that apply. What kind of medication is theophylline? Is it bronchoconstrictor or bronchodilator? Asthma? Yes. Yes, definitely dilator. Yeah. Work on cyclic AMP. Yeah. And relax the bronchial smooth muscles. Yeah. Okay. Yes. Does this medication have narrow therapeutic range? Do we need to worry about that one? Yes. Yes, future RN. Definitely. This one is the one of the one we need to be very aware about because toxic dose can happen anytime and it is very small. So close monitoring is required. Avoid caffeine. What will caffeine do? I think we have discussed in our previous live also. This is one of the medication. Yes, it will cause tachycardia definitely, but how it will cause? Because theophylline and caffeine have similar chemical structure. Okay, they both have similar chemical structure. So theophylline toxicity increase when you have coffee and theophylline together. Okay, so that's why you will see more tachycardia, and they affect definitely they affect beta cells. They caffeine itself affect beta cell to produce tachycardia. You know, yeah. Yes, Janet. Report nausea and seizure. Is it one of the side effect or not? Do we need to worry about that one? Yes. Yes, definitely. It is actually nausea is actually one of the earlier signs. Just JJ toxic, definitely. Nausea is one of the earlier sign of toxicity. So we really need to report that one. And seizure is one of the late and life-threatening sign. Okay. You can also see arrhythmias. You can also see arrhythmias in this medication because especially when we have severe toxicity, and that's why we really want to avoid caffeine in this medication because they both can work on the same way. Alrighty. Safe with ciprofloxacin. Is this medication safe to give with cipro? I think we done cipro yesterday. If you guys remember, why we don't wanna give this medication with cipro? What is one of the function of cipro that can increase the toxicity? Cipro inhibits CYP enzymes. Okay, and those enzymes are responsible for metabolism of theophylline also. So that's why when cipro will inhibit those enzyme, there are higher chances of toxicity. So that's why we really don't want to give with cipro. Okay, so we are gonna cross it over. Monitor drug level regularly. Is it essential for all the medication? Most of the medication, those have narrow therapeutic range, such as theophenylline. Yes, definitely. Yes. So we will monitor the drug level just to check the throw level and peak level, just to see whether it's working or not. Okay. 45. The nurse is caring for a patient with hydralazine IV on hypertensive crisis. Which assessment are priority, guys? Select all that apply. Is blood pressure priority? Because how does hydralazine work? Because it's direct acting vasodilator, so blood pressure is definitely priority because it can relax the smooth muscles, it can cause too much vasodilation, and that can increase or reduce the blood pressure. Okay, and it does have more effect on arteries rather than veins, so that's why we need to be very careful. Okay, heart rate. Does this, yes, work too good? Definitely. Let's like heart rate. Do we need to worry about heart rate? B. Yes. Yes, Sunny, definitely. It can cause reflex tachycardia or rebound hypertension. Okay, it can cause reflex tachycardia because this medication is causing the vasodilation. So now sympathetic nervous system need to be activated, and heart will try to compensate, and that's why you will see tachycardia in the patient. Definitely we will have heart rate. Fluid status, is that important? We just need to rationalize why fluid status is important, what's going on in the body, what can happen when there is vasodilation going on. So we know this medication can cause too much vasodilation and is direct arterial vasodilator. What can happen with the fluid? What can happen? Large output? Actually, no. Hypovolemic? Yeah, body will start retentioning fluid more. Okay, body will start retentioning, so that's why monitoring the fluid overload is important in divan. Just future RN, this live recording will be on YouTube. It will be uploaded by tomorrow. Done. All the lives that we do now with questions, everything will be uploaded on YouTube, so you guys can go anytime. Okay, even though you miss some of the questions, so that's why everything will be there. Okay, can we see reflex bradycardia? We just discussed that one. Are we gonna see tachycardia or just fluid overload, Leslie? Yes, because there is too much vasodilation and body is trying to compensate everything. Okay, that's why there will be fluid overload. Okay, yes. No reflex bradycardia. We're gonna see reflex tachycardia. That's why we need to watch the heart rate. And signs of lupus-like syndrome. Lupus-like syndrome. Um, Actually, no, because definitely, if you are giving the long term medication, definitely. But the question here is for the hypertensive crisis. Okay, if you are giving the oral hydralazine for long term, then definitely you can have some signs of lupus like syndrome, like for short term. But because we are giving medication for hypertensive crisis only, and that's not gonna stay for a long time. Okay, so this is the another thing for the answer. Otherwise, this medication can have lupus like syndrome. So right now, in context of this question, I'm gonna say no, because this medication we are going doing for hypertensive crisis. Okay, if everyone agrees, please let me know. And this is the reason we need to say no to this one. Okay, it's just, yeah, so this one is gonna be no. Okay, let's move to question number 46. We only have 5 questions left on pharmacology, and then we will move to prioritization questions. Okay, I will try to post all these 50 questions on YouTube in batches. The nurse is teaching about valporic acid. What side effect should be reported? Select all that apply. Why we use sodium valproate, guys? Why we use that one? Bipolar seizure, yes, seizure definitely anticonvulsant. It's broad spectrum anticonvulsant, and most of the patient, 99% of the patient I have seen with seizure definitely have sodium valproate prescribed. Okay, and they work on GABA. Yeah, yeah, anti-epileptic. Sweet. Okay, do we need to worry about hepatotoxicity? Do we need to worry about ADE? Let's see, Fatima. Yeah, because this medication is metabolized by liver, so it can actually cause severe liver damage. And if someone is on long term use of this medication, so we need to be worried about that. So what we need to do that, what we need to regularly check in this medication, just to make sure it is safe for the patient. Anything we can do? Enzymes, yes, definitely. So we always check valproate level and liver function test just to make sure this medication is safe. Okay, pancreatitis. Can this medication cause pancreatitis? Actually, yes, yes. Yes, Leslie, it is yes. I'm really not sure about the mechanism, honestly, how it do that, but they say it's idiosyncratic reaction, so that's why it does have potency to cause pancreatitis. So I will definitely do some more research on that one, and we can go deeply. Okay. Thrombocytopenia. Thank you, Jason. Thank you for flower. Thrombocytopenia. What is thrombocytopenia, guys? What is thrombocytopenia? Low platelet? Yes, yes, dash. Definitely. It is because this medication can interfere with production of platelet and even function. So that's why we can see thrombocytopenia. Alrighty. Rash. Can we see rash in these medication? Anyone? Yes, yes, definitely. Yes, we will see rashes, and one of the important um, thing we will see in this one is Saint John syndrome, Steven Johnson syndrome. Okay, so that is very, and rash will be the first indication of Steven Jones syndrome. So that's why we need to be very careful in this. All good. Weight gain. Can this medication cause weight gain? And do we need to report that? Do we need to report that? It is expected? Yes, definitely. It is expected side effect. So we don't need to worry about this one because we know this medication is gonna cause weight gain and it's not a life threatening conditions. So we don't need to actually worry about weight gain. Okay, especially patient will feel more hungry. And then another thing is that this is the medication, like especially in adults, is not kind of weight based. It is kind of based on the level of medication in the blood. That's why we check the valporate levels. So weight gain, yes, they do. Yeah, yeah. Okay, so I'm gonna say no just here because it is expected, but other symptoms definitely are more prominent. Okay, four question left, guys. Question number 47. A patient is taking glipizide should be instructed to select all that apply. What we are gonna teach patient, what kind of medication is glipizide? What does glipizide do, guys? For diabetics, yes. So it is one of the sulfonylurea. Okay, it does prompt ATP potassium channel on, yeah, on pancreas beta cell to produce insulin. Okay, so do we need to take it 30 minutes before meals? Is it appropriate? Yes. Yes, because definitely what's gonna happen if you are not gonna take it 30 minutes before, then it's not gonna stimulate the insulin production at time when we will have blood glucose at peak. Okay, so we do need that at right time. Okay, monitor for hypoglycemia. Be yes. What can happen? What can happen? Hypo won't work. It can produce too much insulin. Okay, it can produce too much insulin at wrong time, especially like if patient is already, yeah, if patient is already having bit of hypoglycemia on that time or normal level of blood glucose, and they have glipizide, too much insulin, yeah, yeah, no food and take medication, definitely. Okay, do we need to avoid alcohol? See, yes or no? All met slow, yes. Yes, avoid alcohol definitely, because that can also mimic the symptom of hypoglycemia and can cause hypoglycemia. Okay, report rash or photosensitivity. Is this medication can cause photosensitivity? Yes, yes, we need to report rash. Yeah, yes, actually, we need to. It can make our skin very sensitive. So we need to. Okay, safe in pregnancy. Is this medicine safe in pregnancy? No. What is the uh, standard? What is the standard treatment or preferred treatment for diabetes in pregnancy? What we can give? What we can give to patient? Insulin, yes, the safest one, insulin. So insulin is always preferred. Okay, yeah, yes, addicts. Okay, let's move to question number 48. So the nurse is reviewing adverse effect of cyclophosphamide, which should be monitored. What kind of drug we have here? Cyclophosphamide. Why we use it? Cancer? Yes, definitely is chemotherapy drug. Yeah, and it break down the DNA strand. So can we see hemorrhagic cystitis in that one? Can we see A? A is yes, because one of metabolite of this medication is acrolein that irritate the bladder lining. Okay, that irritate the bladder lining. So that's why you will have hemorrhagic cystitis. Alopecia is B concerning? Yeah. Yes, yes. Hair loss, we know hair loss is common side effect because they have cytotoxic effect on the rapidly dividing cells. So that's why because of that cytotoxicity you will see alopecia. Okay. So acrolein. So this is the metabolite. That's why you have hemorrhagic cystitis. Okay. SIADH, SIAD, all are correct. Let's see. Can we see syndrome of inappropriate ADH? Yes or no? Anyone? Actually, we don't see that in cyclophosphamide. What kind of medication we can see SIADH? What other chemotherapy drug we can see this side effect? Any other one? Cisplatin? Yeah. Vincristine? Yeah. So you don't see cyclophosphamide causing, CR. So we are not gonna worry about that one. Myelosuppression. Can this medication cause myelosuppression? Guys, please keep double tapping the screen. Yes, most of the medications, most of the cytotoxic medication, this is the one of the cytotoxic drug effect. Okay, myelosuppression, alopecia is very common. Is very common. Okay, so we are gonna see that one. And nephrotoxicity. What can happen in nephrotoxicity? Yes, because too much accumulation of medication can damage the tubules. Yeah, so that's why we can see nephrotoxicity in the medication. Hematuria, yeah, especially in the later stage. So yes, yes, definitely. Okay. So only two questions left for pharma. I will make separate video for these 10 question and I will post it on YouTube so you guys can go back, you guys can review anytime, you guys can share with your friends and colleagues. Okay, question number 49. A patient is receiving octreotide for GI bleed. Which findings should be monitored? Select all that apply. What kind of medication we have now? What is octreotide? Anyone? Love it when you say yes, yes, yes. Yeah, smetostatin. Yes, nice dash. What is function of smetostatin? What is function of smetostatin, guys? Any fuse symptoms, fuse functions, like what is the main functions? Does somatostatin increase or inhibit the activities? Is it inhibitory hormone or excitatory hormone? Inhibits, yeah. So somatostatin is inhibitory hormone. Okay, it inhibit everything. It will inhibit hypothalamus, pancreas, GI tract. Even it works on our endocrine hormones like growth hormone, thyroid, insulin, glucagon, whatever you can say. It will inhibit most of the functions. Okay, yeah. What we gonna see now? We have bradycardia. Can we see bradycardia? Is A correct? Yes, because we just talk about that one, because it inhibit all the functions. It inhibits all the functions. So one of this function is inhibiting the central nervous system. Okay, inhibiting the central nervous system. So that's why when we have central nervous system regulation decrease, then that affect the heart rate. Okay, so we have bradycardia, hyperglycemia, all will decrease. Yes, everything will decrease. Yes to all. Nice. We will see how we go. Okay, come on. Are we gonna see hyperglycemia? Why we can? And actually, we can have hyperglycemia. We just talk about that. We just talk about that. Why we can see hyperglycemia? Inhibit insulin, definitely dash inhibit insulin. Okay, that's why, because it is inhibitory, so it inhibit most of the hormones. Okay, so hyperglycemia because we don't have enough insulin in body right now. Abdominal pain. Why it can cause abdominal pain? Anyone? Yes. Yes, definitely we will have abdominal pain. Anyone have any idea? Prostaglandin can be, can be, but yes, that's definitely because there is too much bloating going on in body. All the functions are reduced in GI tract. There will be nausea. There will be abdominal pain. There will be bloating. Yeah. Okay. So inhibiting all the function, whatever you guys are eating, yeah, is staying there. Can we see gallstones? Is it common to see with octreotide? Yes. How it can be yes? If it is yes, how it can be yes? What's going on with gallstone? What is happening over there? What is happening? Inhibit gallbladder. Yes. So everything is inhibiting. Okay. It reduce the mobility, mortality. Yeah. So we have that one, and yeah, biliary stasis. Yes, Mehrana, biliary stasis definitely, and that's why you have gallstone formation over there. Okay. Can we see seizure in this medication? Can we see seizure in this medication? What about E, guys? Do you think it is something can happen by inhibiting something? No. Yes, Saran. Okay. So we don't see seizure because most of the time, when we see seizure, like when there is too much information going on in brain, okay, too much conductivity between the neuron. So suppose car can go at only 100 kpm, kilometer per hour, kph, and you are driving it at 500. You are over exceeding the limit. You definitely gonna end up in any incident. That's how seizure happening. Okay, when we our brain try to pass too much information at one time, that's how seizure happen. Okay, this medication is going, actually we talk about this medication is gonna um, depress kind of central nervous system. Okay, so patient might will feel drowsy, patient will might will feel lethargic. Okay, that's why we will not see any seizure over there. Shall we move to our last question of the day for pharma, and then we can move to prioritization? Yes. Alrighty. Question number 50. Everything, Leslie, everything is slowed down, everything is inhibited. That is actually you are giving patients somatostatin. Okay. Yeah, you are giving patients somatostatin. So if we know what are the normal function of somatostatin, we know the medication function. Okay. Okay, the nurse provide teaching for a patient starting dantrolene for muscle spasticity, which should be including. Okay, what kind of medication is dantrolene? What kind of medication it is, guys? Muscle relaxant. Everyone happy with that? Yeah, muscle relaxer. Yes, definitely. Okay, so can we see jaundice? Can we see jaundice? Yeah, jaundice. Actually, we can see one of the significant side effect of dantrolene is jaundice. Alrighty, yeah, it can be reached to that level of hepatotoxicity where it can damage the liver, and that is the first sign of liver damage when we have jaundice. So that's why we need to report it. Okay, may cause drowsiness. Yes, yes, JJ. May cause drowsiness, can it? If it can cause drowsiness, why it can? Amanda is saying, let's say you don't know the medication, how can you choose the right answer? That is very hard, Amanda. If you are just if you have gone through medication at least once, you will have bit of idea. It will hit you. The I just calm down, relax, give it 2 minutes, and then you will know the answer. Okay, and that's why we do the rational. Otherwise, just think about, okay, think about something and just put any random. I'm just kidding. Please read all the medications. Okay, it can cause drowsiness because it is muscle relaxant. It is muscle relaxant, so it can cause be easily. Do we need to avoid CNS depressant? Yeah. Do we need to avoid CNS depressant in this medication? Yes, yes, because combining dantrolene with other CNS depression can even alcohol or any other sedative, they can increase the sedation and dizziness. So we need to be very careful. Umbrella, the answer there is yes, they are used in treatment of malignant hyperthermia. Is D correct? Yes. Okay, guys, this is the only medication. Yeah, this is the only medication that is being used for rare and life threatening reaction to anesthetics. Okay, malignant hyperthermia. Okay, so please don't forget this medication because it's very easy to remember one of a kind medication. So don't forget this one. This is medication that can be used to treat malignant hyperthermia. And if everyone is aware about what is malignant hyperthermia, I just told you guys. Okay, it can be reaction to anesthetic medication. Not all of them, but few of them. Alrighty. So this is the medication kind of, I will not say antidote, but this is only one that's gonna help over there. Okay. Take with high protein meal. Question number option E, yes or no. Is there any specific instruction about food? It's one of the med on NCLEX. Definitely, JJ. This medication is very important. Okay, so yes, yummy. So malignant hypothermia we have, that is the hypothermia reaction when to the anesthetic medication. Okay, this is the reaction to certain anesthetic. It is very rare, but it is life threatening. Okay, this medication doesn't have anything with food. Okay, particularly when it's a high protein meal, don't worry about that. If medication saying with meal or without meal, it's always good to see whether medication is GI tract irritant or not. Okay, then we will take it with meal. If medication is not GI irritant, then they usually don't have any relationship with food. So this is very specific, take with high protein meal. Okay, it doesn't have any specific instruction, so we don't need to go with that. Okay, I will double think when it will say with meal or without meal. GI irritant, the medications that can irritate GI tract. Okay, or those have more function on the GI tract. Yeah, so it's always good to make a list of medication, like, and then yeah. Alrighty. So this is our first 50 question for today, 41 to 50, and we have done previous 40 question. So what I will do, I will make 5